Today we will discuss COPD, but really quickly. Are you fed up with lecturers using complex vocabulary to appear smarter? Whether you are a current student or healthcare provider, doctor, nurse, pharmacist, seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. Chronic obstructive pulmonary disease, COPD, is a lung condition that makes it hard to breathe. It usually involves two main problems: chronic bronchitis, which causes a long-term cough and mucus production, and emphysema, which damages the lung's air sacs, alveoli. Key points about causes: most often caused by long-term exposure to harmful substances like cigarette smoke or air pollution. Symptoms: common symptoms include ongoing cough, shortness of breath, especially during physical activities, wheezing, a whistling sound when breathing, frequent respiratory infections, fatigue. How to know if you have COPD. 1. Symptoms. If you experience the symptoms mentioned above, it's important to pay attention. 2. Risk factors. Consider your history, such as smoking or exposure to lung irritants. 3. Medical assessment. A healthcare provider can perform tests like spirometry, a breathing test that measures how much air you can exhale and how quickly. Chest X-ray or CT scan. These images can show lung damage. If you suspect you have COPD, it's essential to consult a healthcare professional for proper diagnosis and management. If someone has COPD, here are simple steps to help manage it. 1. See a doctor. Regular checkups can help monitor the condition and adjust treatment. 2. Quit smoking. If they smoke, quitting is the most important step to improve lung health. 3. Take medications. Use prescribed inhalers or medications to help open airways and reduce symptoms. 4. Stay active. Gentle exercises like walking can improve breathing and overall health. 5. Avoid triggers. Stay away from smoke, dust, and strong fumes to prevent breathing problems. 6. Practice breathing techniques. Learn and practice breathing exercises to make breathing easier. 7. Eat healthy. A balanced diet can help maintain energy and overall health. 8. Stay hydrated. Drink plenty of water to help thin mucus in the lungs. 9. Get vaccinated. Stay up to date on vaccines like the flu shot to prevent infections. 10. Join support groups. Connecting with others who have COPD can provide encouragement and tips. Always follow advice from healthcare providers for the best care. In the hospital, if someone with COPD is having a severe episode, here's what the medical team might do. 1. Oxygen therapy. They may give extra oxygen to help the person breathe better. 2. Medications. They might provide fast-acting inhalers or steroids to reduce inflammation and open airways. 3. Breathing treatments. Patients may receive nebulizer treatments, which deliver medication directly to the lungs. 4. Monitoring. Healthcare providers will closely monitor vital signs like heart rate and oxygen levels. 5. Fluids. They might give fluids through an IV to help keep the person hydrated. 6. Chest physiotherapy. Techniques may be used to help clear mucus from the lungs. 7. Education. Doctors will often explain how to manage COPD better after discharge. The goal is to stabilize breathing and prevent further complications. Here are some commonly used medications for COPD. 1. Bronchodilators. Short-acting: albuterol, Ventolin, Proventil. Long-acting: salmeterol, Ceravent, formoterol, Foradil. 2. Inhaled corticosteroids. Budesonide, Pulmicort, fluticasone, Flovent. 3. Combination inhalers. These contain both a bronchodilator and a corticosteroid. Budesonide, formoterol, Symbicort. Fluticasone, salmeterol, Advair. 4. Phosphodiesterase 4 inhibitors. Roflumilast. 5. Antibiotics for treating infections. Azithromycin. Amoxicillin. Always consult a healthcare provider for personalized medication recommendations. People at an increased risk of developing COPD usually include 1. Smokers. Those who smoke cigarettes or have smoked in the past are at the highest risk. 2. Ex-smokers. Even after quitting, former smokers still have a higher risk than non-smokers. 3. People exposed to pollution. Those who live in areas with a lot of air pollution or work in environments with dust and chemicals. 4. Workers in certain jobs. Jobs in construction, mining, or jobs involving chemical exposure can increase risk. 5. People with frequent lung infections. If someone has had many respiratory infections in childhood, they may be more likely to develop COPD later. 6. Family history. A family history of lung diseases can increase risk. 7. Older adults. The risk increases as people get older, especially those over 40. Being aware of these factors can help in taking steps to reduce risk. Now you need to watch my video on bronchitis or have a look at pneumonia.